Hey, good morning, good afternoon, good night, wherever and whenever you all are viewing this webinar today. I know this is a little bit different format than everybody's probably used to, but don't worry. We'll have more information at the end on opportunities to participate in a live Q&A office hour session with CMS. Today, we're really going to focus on our MIPS overview information for 2024. So hopefully we'll get to a lot of your questions, but if we don't answer them throughout the presentation today, there'll definitely be future opportunities. So here's a quick run of show, what we're going to cover today. So we'll do a brief introduction, and then we're going to jump into our merit-based incentive payment system, MIPS eligibility criteria. We'll cover participation overview. We'll briefly touch on final score and payment adjustment basics for 2024. And then we'll really get into the meat of the presentation, which is focusing on our different performance categories and all of the requirements that were finalized for 2024. Then we will touch on our APM, the Alternative Payment Model Performance Pathway, or APP requirements. And then we'll end today's video with some helpful information on where to go if you have questions, or really how to get started in MIPS and where to begin. And throughout today's presentation, I will be flagging where we have some different resources that go into more detail on all of these different areas. Today's really meant to be an overview session to get started with the program, but know that some folks have participated in this program for a long time and know a lot of the basics about the program and want to jump into more deep dives. So we'll have more information in the future on those types of sessions. So if you are brand new and have never heard of the Quality Payment Program, welcome. We're glad you're here and ready to learn some new information hopefully today. The Quality Payment Program, which we typically refer to, you'll hear us say QPP. It's a value-based payment program that was established in 2015 through the Medicare Access and Chip Reauthorization Act of 2015, the legislation we refer to as MACRA. And MACRA really ended the Sustainable Growth Rate Formula, the SGR, which would have resulted in some seriously significant cuts to Medicare payment rates for clinicians. And at that time, there were also several different reporting programs that clinicians were really siloed and reporting different information they were required to participate in. So the goal of MACRA is really to advance a forward-looking coordinated framework for clinicians so that they can successfully participate in QPP. So QPP, there are two participation tracks that reward value. So the first, which we're really focusing on today, is MIPS, so the merit-based incentive payment system. But there's also a second track for advanced alternative payment models. And beginning in 2024, if you participate in an advanced APM and then achieve QP status, so qualifying APM participant status, you're then eligible for an increased QP conversion factor, and you're excluded from MIPS. And next slide, we'll get into that a little bit more detail. So over the years, there has been some confusion between these two participation tracks. So this graphic really helps to kind of visualize this overlap that we see sometimes, where clinicians are participating in advanced APMs, but they're still required to participate in MIPS. So we have all of the eligible clinicians that are eligible to participate in QPP, and of those clinicians, we define MIPS eligible clinicians. So if those clinicians also participate in an advanced APM, just because they're participating in the APM doesn't automatically exclude them from participating in MIPS. So if they do not achieve QP status or partial QP status, then they'll be required to participate in MIPS. However, if they do achieve partial QP status, they have the option. They can choose whether or not they want to participate in MIPS. And then if they achieve full QP status, this is where they are excluded from MIPS, and they'll earn that 3.5% APM incentive payment for 2024. So here we have some basics on MIPS eligibility for 2024. So if you report, you have to report in, there are 4 performance categories for MIPS. There's the quality performance category, improvement activities, promoting interoperability, and cost. And the first 3, as you'll see, this is where you report, measure, and activity data or test to completing improvement activities or promoting interoperability measures. And then cost is where CMS collects and calculates that data for you. And we have a little bit more details later on the presentation, but briefly, a final score for performance is your performance across all 4 performance categories that results in a score from 0 to 100 points. And your payment adjustment is we take your final score, and that determines whether you receive a negative, neutral, or positive payment adjustment in 2026. So these payment adjustments are based on performance during 2024, and then they're applied to payments for Medicare Part B covered professional services starting in 2026. And as I said, we'll go over more detail on this shortly, because I know there's always a lot of questions about that area. And since we're beginning to talk about eligibility, it's important to know, and I know we have in future slides, we'll show you exactly where to go, but I just want to start here by saying on qpp.ts.gov website, we have a really great participation status tool that makes it simple to put in your MPI and figure out whether or not you're eligible or required to participate in MIPS. So there are 3 MIPS reporting options available for 2024. If you've been around the program since 2017, you'll be familiar with our traditional MIPS option. This is the original way clinicians participate in MIPS. You select quality measures and improvement activities from a complete inventory of MIPS measures. And clinicians, there is a great tool. I'll try and flag them throughout the presentation, but I know we have at the end some slides that show where to go for more information. But there's a great tool on our website where you can, our lookup tool for our measures and activities, and it has this great shopping cart feature that makes it easy to see what options are available to you and gives you a lot of detail. And then also in traditional MIPS, you report the complete promoting interoperability measure set. You'll be scored on all cost measures that meet a certain case minimum. And the next reporting option is MIPS Value Pathways, which was a brand new reporting option in 2023. So this will be the 2nd year that it's available. And again, we have on our website, there's an entire page dedicated to MIPS Value Pathways, or we refer to, you'll hear say MVPs. And that tells you all of the details you want to know about this new reporting option. So, and really what it is, it offers clinicians a more meaningful way to participate in MIPS, and it's a subset of measures and activities that are really specific to a certain specialty or medical condition. Again, they're meaningful groupings of measures and activities that we're able to assess the quality of care on measures that make sense for how the different clinicians practice. And this is the only option where you have to register. So there'll be more information available on when and how to register and things like that. But clinicians select from the quality measures and activities available within their selected MVP. And then they report the complete promoting interoperability measure set, and they'll be scored on every cost measure available in their MVP for which they meet certain case minimums. And then our third option is our alternative payment model, the APM Performance Pathway that we refer to as the APP. And this is really created to reduce reporting burden and ultimately encourage participation and movement into into these alternative payment models. And again, for MVPs, there's also another tool. We really try and develop these tools that help clinicians simplify these reporting requirements and know how and where to participate in the program. So there is an Explore MVPs tool available on the website if you want to look more into that reporting option. Okay, this is a really helpful graphic because sometimes our program at any point in time, you could be talking about three different calendar years. So it really helps in trying to understand our policies or requirements if you ground yourself with a specific time frame or year you're talking about or time frame in the program, especially when you're asking questions, talking to our service center staff or reaching out to a CMS staff person. It really helps to first know where we're talking about in the performance year, so we can get to the best answer. So right now we are currently in our calendar year 2024 performance year. So right now, beginning January 1st through the end of the year, December 31st, when it closes, this is when clinicians are doing the most important thing. They're caring for their patients, and they're doing all the wonderful work that you do every day. And then along the way, collecting that data, recording that information, so that when we move into the next phase that begins January 2nd, 2025, is the data submission period. So the deadline for that will be March 31st. As of today, it's March 31st. Sometimes that deadline gets shifted depending on what's going on in the world, but we are tracking to March 31st for 2025. And this is where clinicians, you log into your systems or your staff or third-party intermediaries, and you submit data to CMS. And we always like to promote early submission of data. That helps you all and CMS too. We always have situations where people wait to the last minute and then something, out of their control happens, or computer crashes, or they have a question, or things like that. So just encourage everyone to submit data as early as possible. And then we move into, so that time period, the beginning of 2025. And then we move into our feedback period. And this is generally, there's not a specific time period like there is with performance year or data submission. Feedback is generally sometime in the summer. And this is where CMS provides performance feedback based on the data that was submitted during that data submission period. And what is provided, there are our final scores and your anticipated payment adjustment information. Clinicians can log into the QPP website, and this is where you'll be able to see how you did based on either the information CMS collected or the information you provided to CMS. And then there's definitely more information on our website, but I just want to mention here that this would be, in this feedback timeframe, would be about when there would also be our targeted review process, which is based on your payment adjustment. If you log in and see your feedback and something just doesn't look right with your payment adjustment, you have a question about that, you have the option to submit a targeted review to CMS, which is really a request that we take a second look at your information and make sure all of your calculations are correct. So there's definitely more information that will come later when feedback's available on that. And then the last part of our timeline here is calendar year 2026, when the payment adjustment goes into effect. So based on your performance and what data is submitted, we develop these payment adjustments, recalculate your payment adjustments, and then in 2026, between January 1st and December 31st is when those payment adjustments are applied on a claim-by-claim basis. So as I said, MIPS is comprised of 4 performance categories. You'll see it again here on your screen. And then each of those performance categories added together give you your MIPS final score. And each of them has a specific performance category weight. So for quality, it's 30%. For cost, it's 30% as well, and those two are required by law to be equal. And then improvement activities is 15%, and promoting interoperability is 25% for 2024. And this gets us our final 100% final score. So real quick here, CMS always recognizes the unique challenges that small solo and small practices are facing. So we have established a number of flexibilities in place to help support them to participate successfully in the program. And one of those is performance category weight redistribution policies. So what you'll see here on the screen is that small practices they're promoting interoperability performance category is always reweighted automatically. Just keeping to know, automatically. You don't have to do anything. If you are in a small practice, your weight will always be redistributed or reweighted to 0 for promoting interoperability. And it'll be redistributed to improvement activities and quality. So for small practices, your performance category weights would be 40%, 30%, 40% for quality, 30% for cost, and 30% for improvement activities. And then for the APP, again, you have a little bit different performance category weight. So 0% for cost because you're participating in an APM. And so that gets redistributed to quality, turns into 55%. Improvement activities will stay at 15%, and then promoting interoperability will be bumped up to 30%. Okay, now we're going to shift gears a little bit and talk about eligibility. So how do we figure out if a clinician is eligible to participate in MIPS? So we have a number of criteria. So we start by identifying if you're a MIPS eligible clinician type. So we have a full list of all the different clinician types. And then we look at to see if you exceed all 3 elements of the low volume threshold criteria during the specific determination periods. And we'll go through those elements in the next slide. We then confirm that you were enrolled as a Medicare provider before January 1st, 2024. So if this is your first year and as a Medicare provider, first, thank you. Thank you for becoming a Medicare provider. But you're not required to participate. And that is really to give people time to acclimate to being a Medicare provider and all of the requirements that come along with that. But then, that requirement, that will fall off after next year once you have that full year under your belt as a Medicare provider. We confirm that you're not a qualifying alternative payment model participant, so QP status we talked about earlier, or that you've achieved partial QP status. So if you meet these criteria, then you are required to participate in MIPS. Just shown in a graphic. So if you are newly enrolled in Medicare, if you are below the low volume threshold, if you are not an eligible clinician type, and if you significantly participated in an advanced APM and achieved that QP status or partial QP status, then you are excluded from participation in MIPS. So here's more on that low volume threshold that we discussed. So the news, there are no changes to the low volume threshold criteria in 2024 performance period. So trying to keep some stability and consistency there. So if you exceed the low volume threshold so you will exceed the low volume threshold and are considered a MIPS eligible clinician if you exceed all 3 of these areas. So first, you bill more than $90,000 a year and allow charges for covered professional services, and you see more than 200 Medicare Part B beneficiaries, and you provide more than 200 covered professional services to Part B patients. Key thing here is the word "and." You have to exceed all three of these different criteria to be included in MIPS. So what is the MIPS determination period for 2024? This is when we look at your Medicare claims for two separate 12-month segments that align to the fiscal year. So the first is the historical period, where we take a look at your claims from October 1st, 2022 through September 30th, 2023 to determine your initial MIPS eligibility. So at this time, if based on all the claims information we've looked at to determine eligibility, if you're excluded during this initial run, you'll maintain this status for the entire performance period. And then our second segment, 12-month segment, begins October 1st, 2023 and ends September 30th, 2024. So as I said, follows the fiscal year. So if you, during these eligibility periods, if you are determined to not be eligible, but you do want to participate in MIPS, thank you. I think that's great. There are still some participation options available to you. So the first one is voluntarily participate. And this is only in traditional MIPS. You cannot voluntarily participate in MVPs or in the APP. So this is a great option for those clinicians that may have missed our brand new Medicare providers and missed the deadline to be required to participate, but they want to try the program out and see what it would be like maybe in the future when they are required to participate. Because there's some information you'll get. So you would submit data, participate voluntarily. You'd submit data to CMS, follow the submission deadlines and everything else that everybody else follows, and you'd receive some limited performance feedback. So that would kind of help you figure out, okay, here's how I did, here's some things I might want to change in the future. And the key thing here is that you won't receive a MIPS payment adjustment. So no matter how you did based on the data you submitted, you will not receive a payment adjustment. The second option is opting in, and this is available for traditional MIPS and the APP only. So individual eligible clinicians, they're eligible to opt in to MIPS if you meet all three of these criteria, or all four of these criteria, basically the opposite of the exemption. So if you're identified as a MIPS eligible clinician type, if you have enrolled prior to 2023, you aren't QP or partial QP, and you've exceeded at least one of those three low volume criteria that we just talked about, then you're able to opt in. And that's at the individual level. And then if you're part of a practice that wants to opt in to MIPS as a group or as part of a virtual group, at least one clinician in your group has to be identified as a MIPS eligible clinician type, enrolled as a Medicare provider before 2023, and isn't a QP. So you have to, and again, exceed one or two of the three low volume threshold criteria at the group level. Okay, this is the participation status tool that I was referencing earlier. This is a really simple tool. If you go to the homepage of the QPP website, it's right there up front and center. You enter your 10-digit NPI, National Provider Identifier number, into the tool, click the button, and it'll give you all the information you need to know about your eligibility, if there's any special statuses, if you're participating as a group or seen as an individual, if you're eligible as an individual or as part of a group, if you choose to participate that way. So initial eligibility is available right now, and final eligibility will be available by the end of the performance year and before the start of the data submission period. So at any point during this presentation, if you are tired of hearing me talk and need to take a break, feel free to pause, check your participation status, and then come back to us. I promise I will not be offended. Next slide covers more about our MIPS eligibility determination. Slides forward. There we go. So we get this question a lot, and it's a really good question. So what happens if you are associated with multiple practices, which a lot of clinicians are, and you see them all in the QPB participation status tool? So you'll see this if you reassigned your billing rights to multiple TINs, so multiple taxpayer identification numbers. You'll see your associations to all of them separately in the QPB participation tool. So what we do, we'll evaluate you based on each of those practices you're associated with, and we look at your TIN NPI combination. And it's important to note that you'll receive a payment adjustment based on those different combinations where you've exceeded the low volume threshold as an individual, or if that particular group you're part of chooses to report data as a group, you'll receive a payment adjustment for that specific TIN NPI combination as well. So you won't receive a payment adjustment at any associated practices with, again, those TIN NPI combinations where you didn't exceed the low volume threshold, or where you were otherwise excluded from MIPS, because we have a number of other reasons that you may be excluded from MIPS. Okay, well, we're going to switch over into participation briefly here. So there are a number of participation options. So there are 5 participation options, or these are the levels at which you can collect data and submit it to CMS. And each of these different options, the availability of them depend on your eligibility status, and then sometimes you have multiple options, and then it's whichever you choose. So the first is individual. So you as an individual clinician, you can participate in traditional MIPS. The APP, again, the APP is only for MIPS APM participants. And then MVPs, you can participate as a group in all 3 of those categories options as well. Again, virtual groups is another option. We don't go into too much detail on what virtual groups are, but they, in really quick summary of what a virtual group is, it is exactly what it sounds like. It's as many small practices that choose to come together and form a virtual group so that they can work together and share the benefits of being considered a bigger group as a virtual group. But we have more information on that participation option on our website too, if that's something you might be, if you're in a small practice with 15 or fewer clinicians, you might be interested in that option, and encourage you to check it out. And it's important to note that you can only report, the only reporting option available to virtual groups at this time is traditional MIPS. And then APM entities are able to participate in all 3, so traditional MIPS, APP, MVPs, or MVPs. And then the last one here, want to highlight are subgroups. This is brand new for 2024, and this is only within MVPs. So subgroups are a subset of clinicians within a group. So we have a lot of of groups that have a lot of multi-specialties in them. So this is really trying to get at getting information from those subgroups so that we're able to compare information across like types of clinicians. And again, subgroups, they have to contain at least one individually eligible MIPS eligible clinician. So for each of our different performance categories, there are certain performance time periods. So it's the length of time that you're required to collect that data for each performance category. So the first one for quality is 12 months. Cost is also 12 months in traditional MIPS and MVPs. Improvement activities, This is a little different, 90 days per activity. Most of our improvement activities have this continuous 90-day performance period, but we always like to point out that there are several improvement activities that have maybe a slightly different. They might have a year-long performance period, completing a module or something different. So just when you're looking at your improvement activities, just be mindful of looking at the activity description and knowing what the time period is for that activity. And then for promoting interoperability, new for 2024, the performance period is 180 days. So there's a lot of different terms on this slide that may not be familiar to everybody. We talk about collection, submission, submitter type. And an easy way to think about it is the submission type. This is the how. This is the how you can submit data. So for each performance category, you'll see there are some slightly different options depending on the performance category and what type of practice you are. So for quality, there's direct submission through an API, and this is an API is basically computers talking to computers. You can sign in and upload data, and then for small practices only, you have the option to submit quality through your Medicare Part B claims. And again, across the board, cost, there's no data submission required for cost. CMS will collect that information based on administrative claims data on your behalf. Improvement activities, this is direct to API, sign in and upload, sign in a test, and the same for promoting interoperability. And then submitter type. This is really the who. Who is submitting this data to me? So is it not to me, you're submitting it to CMS. Are they individual groups, virtual groups that we talked about, subgroups, APM entities, could have partnered with a third-party intermediary to submit on your behalf, and then also CMS-approved survey vendors for a CAS for MIPS survey. There are a lot of different options, and as you'll see, it all depends on the different performance categories. And then collection type, briefly, is the what. This is what you are submitting. So there's a lot of different options, as you'll see here, for the quality performance category. And then cost, again, you don't need to submit anything to us. And then for improving activities and promoting interoperability, these are basically an attestation where you tell us that you completed these different measures or activities. Okay, we have one quick slide, but I know a lot of times people have more detailed information they're looking for, so don't worry, there's more information on our QPP resource library about final score specifically and payment adjustment information. But at a high level, first I want to note that if you aren't aware, MIPS is a budget neutral program. And really what this means is that the amount you receive for your positive payment adjustments in this program is determined by the number of negative payment adjustments that are also distributed. So that's an important concept to keep in mind, budget neutrality. You'll probably hear that a good bit when we talk about payment adjustments. The performance threshold for 2024 remains at 75 points. So that's the key number here, 75 points. So 75 points is the minimum final score that you need to avoid that negative payment adjustment for 2024. And then what we do is we compare your final score to this performance threshold. So the points you received in all those different performance categories that we talked about, they get added up, compare to this threshold, and see where your performance lands. So in this chart, you'll see if you score between 0 points and 18.75, you'll receive a maximum negative payment adjustment of negative 9%. And then if you score between 18.76 through 74.99 points, you receive a negative payment adjustment, and it'll be between that negative 9% and 0. And then if you reach that performance threshold, the number of 75 points, you'll receive a neutral payment adjustment. So just keep everything as is, 0%. And then if you achieve 75.01 through 100 points, you'll receive a positive adjustment. And as I mentioned at the start of this slide, that budget neutrality piece. So right now, you know that you'll receive, if you score on those points, you'll receive a positive payment adjustment greater than 0%. We just aren't sure at this time how much that payment adjustment will be. So it'll depend on all of the data that we receive in from all clinicians in this program. And then once the payment adjustments are issued during that feedback period that we talked about, you'll know how much that positive payment adjustment will be. Okay, I know there's a lot of information. We just covered a lot of different topic areas, got some basics under our belt, and then we're going to shift gears a little bit and jump into each of our performance categories and talk a little bit more about the requirements in each of those. And I just want to point out that with each of the subject areas that we've talked about so far, and then definitely with these performance categories, we have a lot of detailed, specific resources available if you're looking to dive deeper and get more detailed information into any of these areas. And we always, after the MIPS Review webinar, we typically have some deep dive presentations related to each of the performance categories, so you can have some more detailed information from the subject matter experts on those performance categories. So more to come there. But we will definitely hit all of the high-level points today. So first, for quality. So for 2024, so in the Physician Fee Schedule Final Rule, the PFS Final Rule, MIPS quality measure inventory, there were a total of 198 quality measures. And this doesn't include our qualifying clinical data registry, our QCDR measures. We added 11 quality measures, including one composite claimant measure. We removed 11 quality measures, partially removed 3 quality measures, which for those, we removed them from traditional MIPS and we kept them in the MVPs that they were a part of. There were substantive changes to 59 existing MIPS quality measures, 3 of which won't have a historic benchmark, and we increased the data completeness threshold to 75%. And again, just want to point out the MIPS Explore Measures and Activities tool that's available that will give you all of the very detailed information, as well as appendices that list out all these measures and details on our website. So a couple more important things. One of the main priorities of the Department of CMS, HHS, is to really expand language access. It's a very important goal that we're striving to across all programs. So for our CAPS for MIPS survey, we updated it so that registered groups, virtual groups, subgroups, and APM entities, we've updated this requirement that they have to contract with a survey vendor to administer the Spanish translation of the survey to Spanish preferring patients. Before it was an option, and now we think it's very important to make it part of the program. And then related to ICD-10 coding updates, we eliminated this automatic 10% threshold of coding changes that previously would have triggered measure suppression or truncation. And we added a provision that allows us to really look at the impact of the coding changes on a case-by-case basis, so that there's not a blanket discrimination across the board. We're able to look at each measure case by case to see if it makes sense to suppress or truncate the measure. And then we added a provision that also allows us to assess each clinician type separately. So you'll see, starting in this slide and then in all of the performance category slides, we try to highlight at the top if we're talking about traditional MIPS, or if we're talking about MVPs or APP, just so that everybody's clear on where things are different, or which which reporting option we're talking about. So right here, we are talking about quality performance category basics in traditional MIPS. So it is, as we said, 30% of your MIPS final score. And again, 55%, it's reweighted to 55% for MIPS eligible clinicians participating as an APM. And you'll see over here on the right-hand side of your screen, just highlighting the resource that's available. So we have our 2024 MIPS Quality Quick Start Guide that dives into a lot more information on this performance category. So it's a 12-month performance period, total of 198 quality measures. You select 6 individual measures and report one complete, or you report one complete specialty measure set. So one must be an outcome measure or a high priority measure if there isn't an outcome measure available. High priority measures, this is really categorized in 8 categories. So outcome, appropriate use, patient engagement experience, patient safety, efficiency, care coordination, opioid related, and health equity related. And all of that information, if you go to the lookup tool or resources on the website, it'll show you with each measure which category it's in and all of the different details you need to know about the measures. And if there are less than 6 measures available, you should report on each of the measures that are applicable, even if it's less than 6. So we mentioned QCDR measures. There are 212 QCDR measures approved, and this is just want to note that these are approved outside of the rulemaking process, but they are available if you choose to work with a qualified clinical data registry. And then you can also select a specialty measure set of measures, and some of the specialty sets include fewer than 6 measures. And then along with our MIPS Quality Quick Start Guide, we also have specialty guides that list all of the different measures that are included in each of our specialty measure sets. And just a reminder, now we're shifting over to MVP, so we just finished talking about traditional MIPS. The biggest difference here is you have to register in advance to report an MVP, and there'll be more information coming out about deadlines and different things for that. Same percentage, 30% of your MIPS final score. Quality performance category, again, is weighted at 55% for APM entities, and it's a 12-month performance period. And if you look to the right, just flagging the 2024 MVP's implementation guide. So you select 4 measures from those available in your selected MVP. So one of them must be an outcome measure or a high priority measure, again, and same as in traditional MIPS. The high priority measures are categorized the same. And then small practices reporting Medicare Part B claims measures will meet the quality reporting requirements by reporting all of the claims measures available in the MVP. So even if it's fewer than this 4 measure requirement. So scoring for quality measures. Measures that can be reliably scored against the benchmark will receive 1 to 10 points. The measures without a benchmark will receive 0 points, or 3 points if you are in a small practice. And this is in traditional MIPS and MVPs, even when the data completeness and case minimum criteria are met. Measures that don't meet the case minimum criteria will earn 0 points, again, 3 points if you are in a small practice. Again, this is another one of those flexibilities we try and put in place to support our small practices in the program. And measures that don't meet the data completeness criteria will continue to earn 0 points. Again, 3 points for small practices. So achievement points. So measures can earn between 0 and 10 achievement points based on performance in comparison to a benchmark. and the volume of data reported. And just want to flag that all of our benchmark information is also posted along with our measure specifications and all of the detailed, if you are a numbers data person and really love looking at measure specifications and benchmarks, we have a lot of that information available for you. And bonus points. So we do have a small practice bonus. Again, just another way we're trying to support small practices. So for traditional MIPS, MVPs, and the APP, CMS will continue to add that 6 bonus points to the quality performance category as long as one quality measure is submitted. And we just put in this reminder here that we've rolled off some, when the program started, we had some other bonus points available, but we have since rolled those off. So there are no longer no longer award bonus points for reporting additional outcome or high priority measures beyond that one requirement, and also for reporting measures that meet the electronic end-to-end reporting criteria. So data completeness, we've referenced this a few times. So we check to see if you've submitted performance data on a minimum percentage of your patients that meet a quality measures denominator criteria. So in 2024, the thresholds are set at 75% for data submitted on QCDR measures, MIPS CQMs, our clinical quality measures, and ECQMs, which are electronic clinical quality measures, so all payer data. And again, 75% for data that's submitted on Medicare Part B claims measures, so Part B data. The 75% is that number to remember. Measures that don't meet this data completeness criteria earn 0 points. So small practices still receive 3 points for measures that don't meet data completeness. Okay, shifting gears over into the cost performance category. So basic information about cost up front. Again, 30% of your MIPS final score, 12-month reporting period. And again, I know we've mentioned this a few times, but there is no reporting requirement. We are going to pull your cost data for you from administrative claims. So those are that you submit to CMS for payment. We'll pull that information. And to be scored on a cost measure, you or your group, if you choose to participate at the group level, must have enough attributed cases to meet or exceed the case minimum requirement for that cost measure. The clinicians and groups can earn up to 1 percentage point for improvement scoring in the cost performance category for 2024 as well. So there are 5. So for 2024, we finalized 5 new episode-based cost measures that will begin with the 2024 performance period. So our current performance period, each has a 20 episode case minimum. So there's an acute inpatient medical condition measure, 3 chronic condition measures, and a measure focusing on care provided in the emergency department setting. We also finalized the removal of the acute inpatient medical condition cost measure, the simple pneumonia for hospitalization. And if you are really interested in cost measure and cost measure development, I encourage you to, again, check out the cost section of our website. There's more information on how to get involved in cost measure development there. So again, focusing on traditional MIPS first, there are 29 cost measures in total for 2024. Clinicians groups and virtual groups will be scored on every cost measure available in the MIPS inventory for which they meet these case minimums. And again, if you look to the right, here's just flagging our Explore Measures and Activities page on the QPP website. So cost measures in MVPs. Each MVP includes the subset of MIPS cost measures. And they're determined what's applicable to that MVP's clinical topic or specialty or condition, whatever the MVP is focusing on. So clinicians, groups, and subgroups will be scored on every cost measure available in that MVP that they registered for. So they looked at all the MVPs, picked which one was available for them specifically based on how they practice, and then for every cost measure that's included in that MVP, for which they meet the case minimums, they will be scored. And just note here, if they can't be scored, that 30% weight would be redistributed to another performance category or multiple categories. It typically moves to quality, but it just depends on the situation. And then achievement points. Measures can earn between 1 to 10 achievement points, again, based on performance in comparison to a performance period benchmark. And again, with this performance category and all of the performance categories, we have our quick start guides available to get you started or to give you more information on the specific category. Okay. Now we are shifting over to improvement activities. So for 2024, in the PFS final rule, we added 5 new improvement activities, subcategories that included population management, behavioral and mental health, patient safety, and practice assessment. We modified 1 existing improvement activity, and we removed 3 previously adopted improvement activities. And those fell into the subcategories of behavioral health and mental health, patient safety, and practice assessment. And again, focusing on traditional MIPS, improvement activity performance category is 15% of your MIPS final score. Again, minimum performance period of 90 continuous days between January 1st and December 31st, 2024. But again, just flagging that that caveat I mentioned before, that there are some improvement activities that require a different period of performance. So just be mindful of that when you're trying to figure out which improvement activity you want to undertake for 2024, because there are 106 to choose from. So there is a wide variety of different activities you can choose, and that will really help improve practice improvement. And again, there is a MIPS improvement activities quick start guide available. So in traditional MIPS, each activity has a weight. So medium is worth 10 points. High weighted activity is worth 20 points. Small practices, non-patient facing clinicians, or clinicians located in rural or health professional shortage areas, so HPSAs, they receive 20 points for each medium weighted activity and 40 points for each high weighted activity. So again, just those clinicians in certain areas or certain types of clinicians that are really facing these additional challenges that many other types of clinicians may not be facing. We want to provide flexibilities where possible. So this is just another area where we're trying to do that. So you select between 1 and 4 activities to earn the full 40 points available in this category. And no data is required. You simply log in during data submission, select an activity that you completed during the performance period, and attest yes to having completed it. So improvement activities in MVPs. Each activity has a weight of medium would be worth 20 points. Again, high worth 40 points. Trying to encourage participation in MVPs. These activity points are the same for all MVP participants, regardless of special status. You select 1 or 2 activities from those available. Again, there's a specific set related to that MVP. So you pick 1 or 2 to earn the full 40 points available in this category. And again, you log into the QPP website and attest yes to completing that activity. Okay, we are at our last performance category. We're shifting over to promoting interoperability performance. Feel free to stand up, stretch, move around a little bit. We are almost to the end, have more information to share. Okay, so for promoting interoperability, again, 25% of your MIPS final score. It's the same requirements. So this one's a little bit easier. Same requirements, whether you're reporting traditional MIPS or you're choosing to participate in an MVP. What is new for 2024 is this minimum performance period of 180 continuous days. So between January 1st and December 31st. Performance-based scoring is at the individual measure level, and it also requires CERT functionality, so Certified Electronic Health Record Technology, that meets the Office of the National Coordinator for Health IT, the ONC certification. There are 4 scored objectives, so e-prescribing, health information exchange, provider-to-patient exchange, and public health and clinical data exchange. And again, we have a Promoting Interoperability Quick Start Guide available in the resource number. So what's new for Promoting Interoperability in 2024? We've updated the CERT definition so that we're in alignment with ONC's regulation that they recently issued in the final rule. We always try and be as coordinated and aligned as possible to make it easier to participate, and we don't have different requirements for different parts of the government. So ONC, they moved away from the addition construct of the certification criteria, so we're trying to follow suit there, and all references to the 2015 edition of Health IT certification criteria have now been replaced with ONC Health IT certification criteria. So instead, all certification criteria will be maintained and updated in this specific citation. So future updates will be incorporated into the CERT definition. And this way, this can happen without any regulatory action by CMS. So we'll just take ONC's lead on this definition. So we've modified the second exclusion for the query of PDM-PEAT measures, so prescription drug monitoring program measure, beginning in 2024. So now it is that any MIPS eligible clinician who does not electronically prescribe any Schedule II opioids or Schedule III or IV drugs during the performance period. And we also finalized to require a yes response for the safety assurance factors for electronic health record resilience guide. I know it's a lot of words. You will hear it referred more often as the SAFER guide measure, beginning with the 2024 performance period. And real quick, just to note for PI performance promoting interoperability performance category, there is a hardship exception application that is available, typically becomes available in the spring. So over the next couple of months, it will become available along with our MIPS extreme and uncontrollable circumstances exception application. But specifically, promoting interoperability application, this is for people that need to cite one of the following 4 reasons for review and approval. If they have decertified EHR technology, there's insufficient internet connectivity where they are, they face some kind of, again, other extreme and uncontrollable circumstance, such as a disaster, severe financial distress, things like that, and then a lack, or they lack control over their availability of CERT. So any one of those 4 they can cite as a reason to request a hardship exception for the promoting interoperability performance category. So if their application is approved, they'll receive a weight of 0, and then that performance category weight will be redistributed to another performance category. And important here to note with this application, I know we don't get into the extreme and uncontrollable circumstances application in this presentation, but similar policy applies that if you submit data, it will override your application. So here with the promoting interoperability application, if you submit data, but even though you have an approved application, the act of you submitting data tells us that you no longer need that hardship relief. So we'll go ahead and score that information. And we do note here on the side, once the hardship application is available, which is typically in the next couple of months, it will be open through the end of the performance year, so through December 31st at 8 p.m. So you'll have a lot of time if you need to submit an application. And again, some other automatic relating that we put in place, special status for people that are in ASC, so ambulatory surgical center-based, hospital-based, non-patient-facing, and small practice. If there are certain clinician types, such as clinical social workers, these clinicians won't need to submit that promoting interoperability hardship application. We automatically reweight the performance category for them. So if you're reporting as a group or virtual group, all MIPS eligible clinicians in the group or the virtual group must qualify for reweighting for the group to be reweighted. So unless the group or virtual group has a special status that qualifies them for the automatic reweighting. So just important to note, needs to be everyone that's in the group or virtual group. And then this is an important change that happened in 2024 we need to highlight. There used to be these additional clinician types that received automatic reweighting, but beginning in 2024, we no longer automatically reweight for physical therapists, occupational therapists, qualified speech language pathologists, qualified audiologists, qualified psychologists, or registered dietitians or nutrition professionals. We still maintain automatic reweighting for clinical social workers. The MIPS eligible clinicians groups and virtual groups that fall into either ASC-based, hospital-based, non-patient-facing, or small practices still receive the automatic reweighting. And again, we say it again here because it's very important that if you choose to submit data in promoting interoperability and you have this automatic reweighting, we don't require you to submit PI to us. You have the option to do that, but just know that if you do, this reweighting gets canceled, and you would have promoting interoperability would be 25% for you as well. Okay, and then briefly touching on the APM Performance Pathway, so our APP. So as we said before, this is a MIPS reporting and scoring pathway specifically for MIPS eligible clinicians that participate in our MIPS APM. So participation in the APP is required. We highlighted it because it's very important, or bolded it. It's required for all Medicare Shared Savings Program accountable care organizations. So Shared Savings Program ACOs must participate through the APP. And it creates this new scoring opportunity for participants in MIPS APMs, and really ultimate goal is to encourage participation in alternative payment models. It's complementary to MVPs and similar but different. It's composed of a fixed set of quality measures in addition to the full set of promoting interoperability measures. So same for traditional MIPS and MVPs. The performance is measured across 3 areas. So quality is 50%, improvement activities 20%, and promoting interoperability 30%. And as we said before, the cost performance category in the APP is always 0. So options for measure sets to use for APP quality submission for 2024. Option 1, ECQMs, MIPS CQMs, or Medicare Part B claims. The 3 measures there, CAPS for MIPS survey, or 2 administrative claims measures. Option 2 is specific for Medicare Shared Savings Program ACOs only. 10 measures in the CMS web interface, CAPS for MIPS survey, and 2 admin claims. Or another option for them would be ECQMs, MIPS CQMs, or Medicare CQMs. 3 measures there, again, CAPS for MIPS survey, and 2 admin claims. So only individuals, groups, and APMs with the small practice designations can report Medicare Part B claims measures, so similar to other parts of the program. And it's important to note that 2024 will be the final year that Shared Savings Program ACOs are able to report through the CMS web interface. After this performance year, it'll no longer be an option. And as we note here, beginning with 2024, Medicare CQMs for ACOs in the Shared Savings Program, so we refer to them as Medicare CQMs, have been established as a new collection type specifically for shared savings program ACOs that can only be reported under the APP. Okay, so now that you have all this information, you know all about the basics of the program, our performance category weightings, your eligibility, how to participate, and you know a little bit about the different performance categories. What do? How do we get started? I know when you look at all this information, it can be a little bit overwhelming to start with, but don't worry. We have lots of tools that we've talked through this presentation and resources available to help you kind of get started in the program. Familiarize yourself is the first step. So first, if you're brand new, or even if you just haven't looked into QPP for a while, just encourage you to first step, go to the website, see what's there. There's a lot of information. Important information is always on the homepage. All of it's important, but we try and highlight key information, especially if there are deadlines and different things coming up that clinicians need to pay attention to. That will always be on the main homepage of our website, but we also have all these different tools. We mentioned the participation status tool, explore measures of activities, explore MVPs, to help you start trying to figure out where and how you want to participate in the program. Again, we have our QPP resource library, which this is all resources about the program. So it's our repository with fact sheets, user guides, and policy resources. We also have a QPP webinar library where we post all of our, which is where this video will be posted, along with all of our other videos and webinars and things that we put on for the public, so that when your schedule permits, you can go back there and reference information or rehear subject matter expert talking about a certain area. So encourage you first to familiarize yourself with all the content and tools about the program. So if you're included if you're eligible and included in MIPS and required to participate, or if you're intending to opt into MIPS, we encourage you to continue learning more about MIPS reporting options and participation options, identify the measures and activities. Either you want to report as an individual or a group will report on your behalf. It's always important to be talking to, if you are part of a group, talk with the other members of your group or your office management staff. We've seen a lot of times clinicians didn't know that their group was reporting on their behalf. So just encourage that communication. Really helps you advocate for yourself. Begin capturing quality measure data. So reminder, quality is for 12 months. So we're not too far into the year just yet, but just reminder to get going on collecting that data. And then here's just some helpful resources we've talked about, places to go, tools to look at. We also want to highlight for our small practices, we have a specific page on our website that lays out all the different flexibilities. I tried to highlight a few today as we went through the presentation, but we have a web page that's dedicated to small practices. We have a newsletter that goes out monthly. I think it's the first Tuesday of the month, so I encourage you to sign up for that. And it's really, we try and take these bigger messages or things going on in the program and tailor it specifically to a small practice so that it gets you specifically the information that you need. And then everybody and anybody, I encourage you, can't say it enough, to sign up for the QPP listserv. It is at the bottom of every page of the QPP website. You can't miss it. It looks just like what you're seeing on the screen. Sign up for the QPP listserv. And this is our main communications tool. So if we have an announcement, new resources posted, if there is some kind of change that happens in the program, anything we need to get out where we need to contact clinicians that will be impacted or are part of the quality payment program, this is our main communications tool. So encourage you to please sign up for that listserv. You just enter your email, click subscribe. It's very easy. But just don't want to miss any important messages or updates about the program. and help. So we get this question a lot. Where do we go? We have help. We have questions. We need somebody to talk to. So we have a quality payment program service center that our agents are very well trained. You can contact them Monday through Friday, 8 a.m. to 8 p.m. Central Time. You can email them, call them, submit a service center ticket if you're more IT savvy and want to do it online. And then if you're deaf or hard of hearing, you can dial 711 to be connected to an assistant. But our agents are very knowledgeable on the program, help answer basic questions, or if you have more complicated situation, we'll get it escalated to the right folks to help talk you through your situation and direct you to the information you need so that you can participate successfully as possible in the program. We really want to help clinicians and your staff and your the groups that you're a part of really participate in this program and improve quality of patients. That's the whole purpose of the program is to improve quality of patients' care that's being provided to Medicare patients. So really appreciate all that you all do every day taking care of Medicare patients across the country and all of your patients. So we are here to support you, and our service center is available to answer questions and help you in any way that we can. So also, if you are really missing a Q&A session at the end of this presentation, like we typically do, have a live session, don't worry, we are planning one. We thought we'd try this new format where you can look through this information ahead of time, think through what questions you might have, because what we've seen in the past is that we have so much information and it's all important to get out there, but it doesn't always leave us that much time for Q&A. And after an hour plus of hearing somebody or multiple people talk, it's a lot of people are ready to go and want to ask their question later. So we're trying this new format where you can get all this information and listen to it as you can, and then we will host office hours Q&A session sometime in the coming weeks. And again, QPP listserv is how we'll communicate when that session will happen and how to register and where to submit questions in advance. So that helps us understand where people are having need more education or more information. So we'll be able to tailor our Q&A session around those. So really encourage folks to subscribe to the listserv. If you're already subscribed, just be on the lookout for registration information and where to submit those questions in advance. And then we'll also be sure to work in time to take in live questions and online chat and things like that, like we typically do. So with that, I want to thank you for taking the time to go through our webinar today and take time to learn more about MIPS and how you can participate, and for everything that you do every day taking care of patients across the country. So really appreciate all that you do, and we look forward to speaking with you at our next session.